Good morning. Time for today's AM Minnesota program. Really looking forward to the program today because I always enjoy visiting with some of the crew from Summit Orthopedics. Dr. Stroemer is in studio. Dr. Stroemer, I'm not going to forget our visit last summer to Rice County Fair where we had the severe thunderstorm and we got things dried out and we got on the air. But always enjoy our visit at the Rice County Fair with you and Dr. Munch too.
Oh yeah, that's great. Yeah, that was just this
last summer.
This last summer, that was a doozy. I think we almost ended up just doing our interview over a cell phone, I think, or something. We lost a lot of power.
Because all of our equipment got wet. It got so windy, and
yeah.
But we were on the air.
Yeah, we were on the air. Yeah, it was good. It's amazing. We're there for 1 hour and
the time flies by, doesn't it?
Time flies by, and at least 10 patients walk by at the fair, that we've seen before. So it's kind of neat to see your patients just not at the office, too.
Well, I'll never forget either that it was one of your younger patients, and I don't know if he had a badly broken leg, but you'd helped him, and he was out there running around at the fair, and to see the pleasure that you took in that, because he was someone that obviously was injured and couldn't do anything, and here he was back to a normal life. That's kind of what makes you get up in the morning.
Yeah, I mean that's what's fun. And obviously when you just see him in clinic, maybe watch him walk down the hallway or in the exam room, it's kind of, it's fun to see him out in the real world.
I think he should have gone on the zipper and taken his orthopedic surgeon along as a thank you for fixing him up.
No, I can't do those rides anymore. Anything spinning, I'll be nauseous for about a day. So yeah, I don't know. I liked that when I was a kid, but I'm getting old.
Getting old is tough, but it beats the heck out of the alternative. But moving right along,
yeah.
We better mention that your new location. It's not so new anymore. You've kind of settled in.
Yeah, we moved there in July, from our old office on the hospital campus, now closer to the highway. Our address is 1645 Lindale, but really I just tell people it's between Mike's Garage and the Faribault Garden Center, right by the new Parker Cole Funeral Home.
On that little frontage road right off.
Yeah. So kind of right there where a lot of people are kind of building everything up right off the highway. So yeah, it's been obviously we're now separated from our therapists. Our therapists are still at our old office, but yeah, our new location there, and we're still open Monday through Friday every day to see people and
on call.
Correct, we're on call 24 hours a day. So if you break your ankle at 8 p.m. and you're in the District 1 ER, they can call us. You could say, hey, I want to see Dr. Stroemer, I want to see Dr. Munch, I want to see Dr. Willie. It doesn't matter. You can always come see us anytime you want.
The nice thing about this location too, it is so easy to see and so easy to find. Minnesota 21 goes north and south through Faribault and that little frontage road just off of it, so it's easy to get in there. Lots of parking.
Yeah, no, it's great. Our space is a little bit smaller, but it really.
How much space does a computer need nowadays?
Yeah, exactly. I mean, it's really the people in there treating you. It's not so much the space. So you can have big, wide hallways, but if you have not so good nurses, then it doesn't matter anyway. So our nurses and our x-ray people and our front desk staff are so good. They've all been doing it so long that, shoot, we could do it in the back of a trailer and we'd probably still do just as good.
I can't imagine, though, what it was like to move everything. And it's always in one spot here. Everybody's kind of gotten used to it, so now you move to a new location. Right. Getting stuff all moved and getting used to where it is now.
Yeah, no, and you know what? The doctors, we had really minimal. We didn't have to do much. Donna Slinger, our office manager, and all the girls there, they're the ones that did it all. So they helped reorganize everything. So I should probably buy them some extra Christmas presents this year.
I think that would be a nice token.
Yeah.
And I'm still waiting. I went to your website this morning. I'm still waiting for Jerry's idea to show up on your website. If it hurts, come and see us.
Yeah, if it hurts, come see us. I know. Well, now that we're part of Summit, they have a whole marketing department. So those people, that's what they went to school for. So I don't know if they'll listen to me and you about that.
Yeah. Now they're professionals. We're just ordinary people.
Yeah, exactly.
Right?
Yeah.
Well, Dr. Stroemer, if you can stand by, we have to take a break for the markets. As I always say, it's never a good thing when the farm guy misses the market report.
Nope.
Yeah, you'll cut me some slack there, right?
For sure, yeah. Hey, half my patients are farmers.
And after the market break, then when we want to talk more about the relationship with Summit and what it's brought to the practice, and not just the practice, but us ordinary people. But first, here's a market update.
Yeah.
And I don't quite understand how it works, but it's all about lost time. So they want to do whatever they can.
Oh, yeah.
The market update was sponsored by the KDHL Agri Boosters, including Northern Buildings. For quality post-frame construction, visit them at their website, northernbuildings.com. My guest on today's AM Minnesota program is Dr. Stroemer with Summit Orthopedics. And Dr. Stroemer, how long was it ago when you merged with Summit?
So yeah, we were the orthopedic and fracture clinic for the last 50 years.
And did you notice I did say Summit twice already this morning?
All right. So yeah, people might be a little confused. I mean, we're the same doctor, same nurse, the same everything. We merged January 1 of this year. And that was a culmination of a year-long process to help serve all our patients here. The five of us do a lot of arthritis stuff, a lot of sports injuries, but there's certain things like spine care or certain foot and ankle procedures, certain hand procedures.
Yeah, or maybe some really unusual hip.
Correct, yeah. That we would have to call some other company and say, hey, you know, we have a patient that needs help, and sometimes they'd call us back, sometimes they couldn't get our patients in. So, you know, merging with a bigger orthopedic group that's completely still doctor-owned and doctor-run, same philosophy as we have as well. If I see someone later this morning in clinic that's got a complicated foot and ankle issue, I tell my nurse, hey, this person needs to see our foot and ankle guy tomorrow, and we can get them in. So this person throws out their back, we need a spine person, see the spine person tomorrow. So
and that person, it's like a subspecialty.
Correct, yeah.
And that's all they do is back, or all they do is ankles, and so they have the very unusual, tough cases.
Correct, yeah, exactly. I mean, I've been doing this now 15 years. I joined the group 11 years ago, and I'm at the point now where, you know, I don't do procedures that I don't do. You know, I just do the ones that I know and I'm good at, and I send the ones that you know, that need it to the right people.
And I think that's the key. Whenever I go to the doctor, I understand that everybody has to learn and gain experience. So if someone is learning and gaining experience on me, it's kind of nice to know that there's somebody experienced available. You get my drift?
Yeah, oh yeah. So I mean, I think with the five of us, I mean, let's see, Dr. Willie, Dr. Shepley are almost 30 years. Munch, fifth, that's 75. I mean, you're almost getting 100 years of orthopedic experience with just the five of us. So lots of stuff we can take care of. And then again, if we can't figure it out or we don't feel comfortable,
I think the key there is don't feel comfortable. This one maybe doesn't look like the routine hip replacement.
Yeah.
So I wonder what this subspecialist thinks. So you can email him or her the x-rays or the MRIs, and you can kind of a team approach then as to what.
Oh yeah, for sure. And again, we're all, number one, conservative and trying to do everything without surgery first, and number two, none of us are those surgeons that'll just do any surgery just because they like to do surgery. I mean, we want to do the right thing for you. We want to get you the right person, and none of us are afraid to. We don't have big enough ego that we are afraid to just give it that. You know, we want you to go to the right person.
And that's what Summit brings to us, and it's really amazing when you think about it that some incredible subspecialists with experience available to ordinary people like me if I would need one.
Yeah, and so this merger, where one of our non-operative spine specialists is now coming at least all the way down to our Northfield clinic, starting, maybe she started now, or if not in the next month or so. And so it's our hope that besides even though we can get you into a foot and ankle person, a spine person, a hand person, they're in Apple Valley, they're in Egan. It's our hope over the next year that we can have, once a week have a foot and ankle specialist come to Faribault. Once a week have the spine specialist come to Faribault.
Especially on follow-up things,
yeah,
things like that. Or maybe my ankle's been bothering me for a long time, and we're trying to figure out what to do. Okay, instead of me writing up, maybe they have enough patients that they can see in one day, so they come down here rather than 10 people writing up there.
Right. So it's been good, I think, for us and our patients that we have a lot more specialists that we can talk to, refer to, get in a lot easier. So, and I think when we moved out of our office, we had been in for 10 years, people got confused that we were leaving town, but we didn't leave town. We're still here, and again, you can come see us anytime you want. We're pretty much want to see you within 24 hours if you call. We're pretty much got that dialed in now to see you within 24 hours if you call for an appointment.
Well, there are some places you have to wait for weeks sometimes, unless it's an emergency type thing.
Right, yeah. I mean, in orthopedics, usually people are coming in because something hurts. And so when something hurts, people want to be seen sooner than later. They might have to miss work. They might have to miss this or that. And so, we recognize that and we want to see you. And so I would say, if you break your wrist, you can go wherever you want. You don't have to go where the ER tells you to go.
I think that's a misconception that I don't have to be referred by my family doctor.
No, most plans now allow you to go without a primary care referral. That's true. Now everyone has their own plans, and you got to check. But a lot of times, if you fall and break your ankle, fall and break your wrist, and they send you home that night, you can come see us. You don't have to. You can go anywhere you want, essentially. So it's your choice. This is thankfully in healthcare we still have some choices that you can pick. And Summit, again, also is really, insurance companies seem to like Summit Orthopedics because their care is good and efficient, and
the outcomes are good.
Yeah, and it's not as expensive as some of the bigger companies, and so we're on pretty much every insurance plan, I believe. So,
and I was going to say, or ask them that you have people there that's their world. So they take care of the insurance claims.
Correct.
I mean, I look at my plan.
Yeah,
I'm supposed to understand this.
Yeah, I don't even understand the bills when my kid goes to the pediatrician and I'm in this business. So, we have people that can double check all that stuff. We don't do anything with you or to you or for you before you're comfortable and your insurance company, is going to cover it. So it's gone as far as...
Or at least I'll know then what my out-of-pocket responsibilities are, and so we can have that discussion.
Even to get an arthritis injection of this arthritis gel they call Synvisc, most insurance companies now require a prior authorization. We used to be able to just give it to you all day, whenever you wanted it, but now it has to be prior authorized. So we have a third-party service that we call them and we say, this patient wants this injection. Within 7 minutes, they're supposed to contact that patient's insurance company, figure out if it's prior authorized, and get back to us. So we're trying to be as efficient as possible because we know you're at the doctor, you're missing work, your kid's missing school, things like that.
And it hurts.
Yeah, and things hurt. So, we're, I think this merger, anytime you merge, there's always speed bumps and everyone has to get used to new stuff, but definitely we're going to be able to provide more efficient care at a better price, quicker, and I think it's going to be good for the people around the whole Faribault, Rice County area.
Yeah, I was going to say, how big a territory do you service? It's probably quite a distance around Faribault then and Northfield.
Well, I mean, I definitely, we have clinics, the 5 of us go to Faribault, Northfield, Farmington, and Lakeville, but I see people pretty far west, closer to Mankato, because they can't get in over Mankato. We see people from Kenyon and all that stuff.
Boy, that's pretty neat.
Yeah, no, and I always tell, I grew up right by the state fairgrounds, go to the state fair every year, and so I climbed on a lot of tractors and I saw a lot of cows at the 10 days of the state fair, but I don't know much about farming, so it's been kind of fun I see a lot of people around here that do a lot of that stuff, and they teach me all sorts of stuff about farming.
But then you also see certain types of injuries or concern, the hips wear out, or you kind of see things that are specific to that industry.
Yeah. I mean, and around here there's a lot of factories, so we see lots of guys that wear out, guys and gals that wear out from their factory work, or they tear their rotator cuff or something. So, I mean, it's been we have a lot of different injuries that we see and deal with, and pretty much, like you said, Jerry, if it hurts, we'll come see us, because we'll figure it out, and if we don't feel comfortable with the treatment, we'll get you to the person that does.
It's still mind-boggling to me, some of the things that you can do when maybe not that many decades ago you just lived with it the rest of your life. Whether the knee replacements and the hips or the rotator cuffs, it probably wasn't that many years ago. Other than trying to mask the pain with cortisone, things like that, you basically lived with it the rest of your life.
Yeah, I think, again, I've only been doing this 15 years, but I think some of my older partners were around when knee replacements were just getting started, hip replacements were just getting started, and now it seems routine to everyone, like, oh, your knee's wore out, go get a new knee. But
I call it your 50,000 mile overhaul.
Yeah, exactly. But I think, I mean, I would say in the only less than 50 years ago, there was a lot of things where, you just said you're kind of stuck here. You got to figure out a way to deal with the pain, and now we can get your pain better and get your function better with a lot of different stuff.
And get back to the lifestyle that you like to lead, whether it's golfing or playing tennis or taking walks or biking.
Yeah, anything. I mean, I obviously. Sooner or later,
no matter what magic you can work, I don't think you're going to make this old body 30 again.
No, but we can get, for most things, I mean, there's a reason why 100-year-olds, or not many, run marathons anymore. Eventually things stop working, but most of the stuff we all want to do with our jobs, with our activities, we can, within reason, get you back to that stuff.
When you think about hip replacements and knees, they kind of get all the attention. But I remember maybe it was Dr. Stroemer mentioned once that there's been huge advancements in different drugs that help the body heal or help with the pain or provide lubrication. And what was that when you just mentioned?
Synvisc?
Yeah. Does that kind of take the place of like the cortisone?
It's a different thing. It's a lubricant. They used to call them rooster comb shots. It was originally invented from the fluid in the comb of a rooster, and that fluid turns out was very similar to the fluid your joints make to lube itself. Yeah. So cortisones, things like that, are anti-inflammatories, whereas this arthritis gel or Synvisc, it provides a physical lubricant, which then things won't get as mad. When the cartilage is not there and it's rubbing bone on bone.
By mad, you mean it hurts more.
Yeah, it hurts more. That being said, some people we provide that injection, and they come back a month later and they say, man, that didn't do anything, Dr. Stroemer. So sometimes their arthritis is so bad that nothing's going to help at that point, and that's when we finally have the serious talks about getting a new knee or new hip, but we almost always want to try everything else first.
And the surgery is the last resort. Part of it too was the age, because if you're 62 like me, well, looking at the average life expectancy, you want to put off that so that maybe the replacement doesn't wear out before I'm worn out, so to speak.
Yeah, ideally the less surgery you have, the better. And so every time you redo a hip or a knee, it's harder surgically. Sometimes your bone is thinner, or the implants have caused the bone to wear down, things like that. So ideally, when people have a joint replacement in their mid-60s, that should, on average, be the only one they'll need in that joint their whole life. But just yesterday, I had a woman who, she had partial knee replacements 15 years ago, and those loosened up, and the rest of her knee wore out. We had to give her a new knee yesterday, and so it happens. It's doable, but ideally, if you're in your 50s, ideally the best things to try to do are to try to lose as much weight as possible, use braces, use over-the-counter anti-inflammatory meds, ice. Hopefully you don't have if you have a job where you're on concrete all day or up and down stairs all day, that's harder. And then injections help, and we try to keep you going until it's the last last resort.
I think you mentioned the one key is to get exercise and try and control your weight. I'm not sure if it was you or Dr. Munch or if I read it somewhere, but it was an incredible example of how much pressure is on your knee by this many pounds.
So every pound you weigh is 4 pounds of pressure across your knees. So even if you lose 10 pounds, that's 40 pounds of pressure off your knees, and it may not seem like a lot, just if you look at yourself in the mirror losing 10 pounds, but that every pound will help your knees and your hips and your low back. And if you want to save money and not go to the doctor, that's one of the best ways to do that, because there's really no way to lose weight except for by decreasing your calories, eating better, and or doing some low impact exercise. And
increase the calories you burn. It's all
it's a
zero-sum game, isn't it? It's
yeah.
Calories in versus calories burned.
Right, and you can do that for free, on your own, and that's really gonna, as much as we want to help you, you can do a lot for yourself before you come see us, and that leads me to say too, when you get a new knee or a new hip, if you're real heavy, that increases the rates of the parts wearing out or the parts loosening or complications. So
it's all you have to kind of look at the big picture.
Correct, yeah. So, all in all, I would say that, this is no secret, but some low impact exercise like walking or swimming or riding a bike, doing that kind of stuff 30 minutes a day is just going to be so good for you overall. And
cardiovascular and everything.
Yeah.
I used to have a treadmill downstairs. I never got into going to a gym because I like being down in lower level with my remote control, watching TV at the same time. I wore out the treadmill. I got an elliptical instead. And I like that a lot better. I can still burn a lot of calories, get the pulse up, but it seemed like my knees, you didn't have that impact quite as much.
Yeah, and everyone's a little different. Sometimes people tell me their leg angles didn't jive with their elliptical, so they went back to a treadmill or vice versa. So
there's no magic for me.
No, and unfortunately you don't get to really try those out until you buy it, which is unfortunate. You get it to your basement and then you realize you don't like it, but that's what Craigslist is for.
Yes,
sell that thing. But no, it's just, and it turns out just some low impact exercise, walking for 30 minutes a day, it increases endorphins in your spinal column, which are natural pain relievers, so everything will feel better. Also, when you move your joints, the lubrication fluid that your body naturally makes has some anti-inflammatory properties that actually will make the joint feel better by actually doing a little bit of movement. So all in all, I can't say enough about trying to just get out there and do stuff. And if you're having trouble with even that, that's we'd be happy to see you and see if there's a way we can. Our therapists are really good about helping us figure out if there's a way to get you some exercise that isn't going to aggravate your joint.
Yeah, I think the key is work with a professional. If you haven't been getting much exercise, you don't want to overdo it and damage something. So you really should maybe be working with someone.
It can be as simple as the way your foot lands with your shoe, and you got to get a different shoe, or we send you over to Burkhart's Myers to get a little orthotic or a heel wedge to try to change the way your foot lands, and that can make your knee feel better. So there's some basic little things that we can help you with, and I think shouldn't have any excuses to not get out and at least do something for 30 minutes.
It's still mind-boggling when I think about what you guys can do. I have this request: if you ever have to operate on me, use lots of sedative. I don't want to hear anything. Wake me up when it's over.
I'd be a little afraid how many stories we'd start hearing if we gave you some of that sedative stuff. Yeah, no, normally if you're talking too much during surgery, well, the anesthesia doctors will make you a little sleepier.
But there's also some. I remember when they did my stint, and I think was it Dr. Burns who did my colonoscopies. Anyway, it's a drug that it doesn't put you to sleep, and it said, if we talk to you, you'll talk to us. We tell you to move your leg, you'll move your leg, but you aren't going to remember anything.
Yeah, usually that's Versed, it's called, and it's a relaxer, kind of sedative, and it gives you a little amnesia. So I think the anesthesia doctors give that a lot before surgery to relax you, and then you don't remember, because everybody's everybody's nervous and scared, you know, when they're rolling into the operating room, and so.
And I don't like to go to the dentist in the sound of the drills, not to mention some of the noise you guys might make.
Right. Yeah, it's amazing. I give injections all day long in clinic, and if someone wants to give me an injection, I'm a typical guy. I clench my teeth, I get all sweaty, and so it's kind of funny that I do it all day long, but I still don't.
Payback is sweet.
Yeah, right. Yeah, but you know, we know that's like you had mentioned before off air that you know when you're injured, and even though I may have seen 1,000 ankle fractures in my life, this is it's your ankle now, and so you're nervous, you're scared.
It's routine for you, but it's not routine for
Correct.
me.
Yeah, we want to make sure we appreciate that, and we know it's the most important thing for you in your life, and so you know we want to know what you do, what your hobbies are, all this stuff, so we can kind of together come up with a treatment plan.
They're getting it's a big picture. It's not get you in, get you treated, get you out. The best success is when you take the time to see the big picture. Yeah,
and that's why, you know, I liked our group when I joined, was because Dr. Shepling, Dr. Willie, Dr. Munch, you know, they, you know, a little bit smaller town, we take our time, we're, you know, if we spend an extra 5 minutes with every patient, you know, I feel like sometimes up in the, you know, other places you get in and out and the doctor was in there for 30 seconds, you know, and so we try to, we know we're going to see you at the grocery store too, so you know we want to be human with you. And
well, it's one of the things I enjoy most about being here at KJHL. I've met the greatest people, and you know what? You've worked together over the years. It's more than a professional relationship. You kind of get to be friends too.
Yeah, and I mean obviously we need to stay objective. If you know, if you come in, Jerry, you're like, oh, Dr. Stroemer, I really need this medicine. I'm like, Jerry, you don't need that medicine. You know, you got to stay a little objective. But no, I'll poke you with needles anytime you want, Jerry.
I appreciate the offer. Hopefully it's a few more years down the road.
No, but again, I think, you know, the couple things that we wanted to just, now that we've moved and there's confusion about are we here, are we not here, we're here Monday through Friday. Every day we're open. You call, we want to see you. We're try like heck to get you in within 24 hours. If you fall and break your wrist, no matter if you're in the ER in South Dakota, you can come home and
they can get you stabilized and comfortable. Then you can come home and get the treatment.
Yeah, we'd be happy to see you. All that stuff. You can go wherever you want. That's the one thing people don't realize is where you go is between you and your insurance company. No one else. No doctor can tell you where to go.
Or ER.
Or ER can tell you where to go. That's between you and your insurance company. And that's it. So. And our phone number has been the same number since I started working here 11 years ago, 507-334-1601. And Jeanette or Ann are the gals that answer the phone, and they'll get you taken care of. They've been doing this a long time, and they'll get you in as soon as we can. And let's say you call with a problem, and we look up your x-rays, and we say, whoa, none of us know how to do that. We won't even have you waste your money or time seeing us. We'll get you hooked up right with the person right away.
With the subspecialist that they would need.
Yeah, oh yeah, for sure.
And that person might even be coming down here in a day or two.
Right. So I think, again, it's business as usual. It's just a different building.
Same people, and you go to any search engine. I checked on it. Type in Summit Orthopedics, and you pop up, and there's all the different locations. Even a nice mugshot of you, Dr. Stroemer.
Yeah. Actually, I've been slacking. I'm supposed to go get some more pictures done, but I've been avoiding the marketing lady. Yeah, exactly.
Well, we've got news coming up. We'll look forward to visiting with you again soon, Dr. Stroemer.
All right, Jerry. Thanks a lot. Appreciate it.
Dr. Stroemer with Summit Orthopedics. Here's news from ABC.